A new study finds Toronto's mental health is collapsing. A report released by ThriveTO in partnership with the Canadian Mental Health Association, CAMH, and the city found that the percentage of Torontonians who describe their mental health as very good or excellent fell from 73% in 2015 to 52% in 2022. Some experts describe the drop as unprecedented. 55% of respondents say that the pandemic had a moderate to extreme negative impact on their mental health. Meanwhile, nearly half said they feel depressed about the future because of climate change. Well, for more on the mental health report, I'm joined by Toronto's Medical Officer of Health, Dr. Michelle Marti. We appreciate your time, Doctor. Obviously, deeply concerning numbers considering this almost 20% drop. What do you, along with the pandemic, what happened in 2015 and onwards that has led to this sharp decline in people's mental health?
Well, and certainly the pandemic had a huge component to that. I mean, we had a number of years where we had interruptions in services, in our daily lives, in our jobs and our functioning. And I think if you see who's particularly impacted in this report, we're seeing some of the biggest drops in our youth and young people. And we know certainly that the whole shift from the pandemic, but also our whole culture, as well as their job prospects or education prospects, have really been shifted in that time frame, contributing to this increase in poor mental health, particularly young people.
How prevalent was the use of, social media, doom scrolling, consuming a lot of bad information, even propaganda? Is that playing a factor at all in these numbers?
We're certainly concerned about the levels of social media use across all ages, but particularly amongst young people, in terms of how are they using that. For a long time during that pandemic, we told people that the best thing they could do is stay at home. And for a lot of people, that meant being online for a long time. Mm-hmm. So we heard that, this was a good thing. And now to shift that to say, no, we don't want people online. And certainly, obviously, people have to be online and on screens for their work and their school. But how do we get back to re-engaging in a more positive, interactive way? And certainly being online and social media can be a positive force for bringing people together. We also saw in this report that 2S LGBTQ plus community was predominantly affected in terms of worse mental health. And we know that the online can be a supportive forum for people to connect, especially if they're maybe living in more rural, remote areas. But it can also be a really negative space where people get fed in, particularly by negative algorithms that keep showing them harming images. So we want to recognize the contribution that it can have into a positive mental health, but also what it could be doing to worsen people's mental health.
I'm curious, Doctor, when we look at a lot of the day-to-day issues that impacts people's mental health, it's the fear of not being able to pay for their rent, buy a home, whether it's pay for groceries. There's concerns about safety, their own personal health, and 46% or 47% deemed the future of climate change as the big reason behind their declining mental health. I'm wondering, does anything about that concern you? I think we can appreciate protecting the environment, but if that's reaching the top of the list for a lot of these respondents, I'm wondering if that highlights for deeper underlying issues with some of those respondents.
I think what we're seeing is a range of impact, and certainly for that increase, and now almost half of people are saying their mental health is either fair or poor. There's going to be a component of those people who really need more significant medical care for their mental health. But for a lot of those people, it's about doing things that we can address in their daily lives. Affordability is a huge component to the stress that people feel on a daily basis that's contributing to poor mental health. So anything we can be doing to try to make people more secure in their homes, to not be worried that they're not going to make rent this month, to make people feel more secure in their jobs, and not fearful that they're going to, not have a job next month, to make food affordability more accessible so they can be, eating healthy foods and feeling better about what they're eating. These are all really important strategies that we need to be working on to improve mental health at a population level. In terms of climate change, I think that this is a signal to us that we need to shift the conversation on climate change. For a long time, it has been around doom and gloom, that the world is ending. And that has a really profound negative impact, particularly on young people who hear that message and become despondent about a future for themselves. I think we need to be really digging into climate solutions and really bringing back the optimism and positivity. Yes, we're seeing climate issues and changes in our climate, but that doesn't mean we don't have tangible and practical solutions that we can be doing to move forward on this issue, and really spinning that conversation to make it more optimistic about the future, because we're seeing the negative impact by just talking about it as a crisis all the time.
Dr. Michelle Marti, wish we had more time, but thank you so much for joining us. Appreciate it.